Hello, my name is Dr. Drew Taft at Foot and Ankle Associates of Southern New Hampshire. And if you are checking out this video, then either you or somebody you know is dealing with what you suspect to be an ingrown toenail. Sometimes ingrown toenails are not, a big, grossly infected, fat, swollen toe around the toenail. Sometimes it can just be this chronic, ongoing soreness around the nail plate. Sometimes it's not constant. Sometimes it can be aggravated with activities or shoe gear. And sometimes no matter what you try, whether you trim the nail back or you soak the toe or you apply antibiotic ointment, or sometimes even going to see your primary care physician who have maybe put you on an antibiotic, things may be getting better but continue to fluctuate back and forth, it is likely that you are dealing with some degree of an ingrown toenail. And it may just be an impingement. The way the nail is curved may not necessarily completely grow into the skin itself, but it can just impinge or put pressure on the toenail, which can be sometimes just as uncomfortable or as painful as an actual ingrowth where the nail has actually pierced the skin, and that oftentimes causes the skin to become quite inflamed, swollen, and draining, and it's generally along either one or both sides of the toenail. And it doesn't have to be just the big toenail, although those are the most common. It can be the smaller toenails as well. There are ways that we can fix it. Sometimes it is just a matter of cutting back the toenail, but the most common way that we treat ingrown toenails is actually to permanently remove the offending border of the nail. And it doesn't have to be a very big piece. It can just be a small, several millimeter slice of nail down the side of the toe that's causing the problem. And not only do we remove that piece of nail, but then we can use a chemical that actually cauterizes the root, so that little piece of nail that we take out never grows back. So ingrown toenails can be fixed. We can prevent them from coming back. The procedure is done under local anesthesia in the office. Generally, there are no restrictions as far as activity or shoe gear after that kind of procedure. There's generally about a 2-week time frame after the procedure where you are doing a little bandage change on the toe, but typically everybody can resume all their normal activities and again shoe gear. So again, if you're having a problem with your toe and you suspect it might be an ingrown toenail, don't hesitate, come on in, take a look at it, and we go from there. Thank you.